relationships. How would you describe the transforming therapy approach to relationship management, or what do you call this course?
Transforming relationships. That course teaches people very fundamental but very important aspects of hypnotherapy for improving relationships, such as going into depth about the relationship with the self, how we need to learn to be able to relate to ourselves so that we're able then to reveal in relationships, to create intimacy in the bonds of a relationship. In doing that, we may be helping clients to uncover the reasons why they have made bad choices for relationships in the past and keep repeating those patterns. History of failure perhaps, what's gone wrong in the past, and how to address that. And sometimes the roots of their problems in relationships go back to unhealthy relationships right back in childhood. So maybe dealing with emotional baggage there, dealing with issues to do with dependency and codependency, and we're dealing with those issues in a very deep way when we're using transforming therapy. So there's an awful lot to consider when we study relationships and how to improve people's performance in relationships. And the Transforming Relationships course are really, the methods and knowledge and skills taught there are invaluable to therapists.
From what you have told before with weight management and smoking cessation, can I assume, or can the participant assume that you will also here teach additional methods in more depth than you would cover them in a more generalized training?
Yes, in the Transforming Relationships class, as in all the transforming specialized classes, we're going into more depth than is possible in the foundation training, in the diploma level of training, because there is such a wealth of knowledge out there from different sources that is all absolutely relevant to hypnotherapy. Knowledge that's been acquired through many forms of psychotherapy as well, for example, in Gestalt and existential approach, cognitive approaches, behavioral approaches. And when we consider the psychotherapy itself as just an offshoot of hypnotherapy, Freud's development of talk therapy, the knowledge that's out there often is not incorporated into hypnotherapy. Most hypnotherapy classes still teach their smoking cessation and weight management on the basis primarily of suggestion, and maybe with a little bit of a nod to old-fashioned versions of hypnoanalysis. And that's a very meager way to deal with these problems. It's much of a band-aid approach, a simplistic approach to the problems, and therefore of short-term value in many cases.
And of course you will add from your almost 40 years experience as a hypnotherapist and your clinical background, your medical background.
Yes, there is a lot of knowledge that I will be bringing in from my own experience, because experience is one of the greatest teachers. One learns a lot of principles and theories in studying psychology and studying hypnotherapy. However, it's out there in the real world of dealing with clients that one learns to hone and develop one's skills, how to be able to use knowledge that you gain from different sources and apply that in the clinical setting without letting theory dominate your approach. And so in bringing knowledge and skills and experience into the training course and passing that on to students, to experienced therapists as well, I believe this is one of the best contributions I can make to the field of hypnotherapy.
Wonderful. That sounds very promising. And I assume that anybody who has a hypnosis background will benefit from this course from your knowledge that you put in there, even if people don't work with relationships.
Absolutely, because the core principles of therapy apply across the broad range of clinical problems, such as motivation, readiness for change, uncovering blocks, dealing with the emotional ideas and the fixed ideas in the subconscious, how to give good programming. Those are critical and common to all the problems that people bring to therapy.
Thank you, John. It was a great pleasure to talk to you, learn more in depth about the courses that we are planning, and I'm looking forward to doing with you the next interviews, the next talks, and prepare the workshops next year. To all of our listeners, have a safe day, good time, and see you soon again.
Thank you very much. Goodbye for now.
Goodbye for now.